At the annual public meeting last year, I made a number of undertakings about our plans for the coming year. I'm pleased to be able to meet with you again this year and report on the progress of our first full financial year since becoming a local health district in January 2011. Last year as chairman, I stated it was my ambition that South Western Sydney Local Health District become renowned for the transparency of its decision-making and involvement of its stakeholders and community. I'm pleased to be able to report to you that over the year we've made significant progress across a broad range of district activities to bring transparency and community engagement into focus. One of our major objectives has been to focus on strategic planning for the district. As one of the most rapidly growing and ethnically diverse districts in New South Wales, we've given considerable attention to developing services and facilities to meet current and future demand. Our planning has been underpinned by the core values of collaboration, openness, respect and empowerment. We've given a high priority to engaging with the community members, senior clinicians and service providers. We've sought their advice on health and service issues facing the district and the service development directions required to improve the health of our local communities. These consultations have highlighted the importance of innovation in providing quality services across all aspects of care, treatment, prevention and early intervention. Now there's two plans being developed. Firstly, a strategic plan which will be a roadmap for service development in the district over the next 10 years. This plan includes actions to improve the way we provide health services and ensure that health services address the needs of our local communities. In addition, a corporate plan is being developed to improve services now and support future service development. This second plan focuses on the next 5 years and includes action to improve how we treat and care for patients, how we collaborate with local agencies and the community, and how we can make services more effective and efficient. Early next year, we'll be consulting with the community about our strategic and clinical services plan to ensure that we are meeting local health needs. Once finalised, these plans will guide our future direction. Research is very important, and we've also worked on a health research strategy to enhance innovation and to build the research skills of our workforce. Fostering research is a crucial part of attracting high-quality clinicians and will improve the health of our community. For this reason, the strategy also includes actions to increase the community's understanding of the value of research and to increase patient and community participation in research. I was particularly excited to participate in the opening and the completion of the Ingham Institute for Applied Medical Research. This new centre signifies a really important milestone in the partnership between the Ingham family, the district and the Universities of Western Sydney and the University of New South Wales, and it provides an ideal base for developing research. Amanda's going to speak to you more about it when she speaks. The district has also partnered with the precursor to the Medicare Local and the University of Western Sydney to develop a new model for integrated primary and community care for the Southwest Growth Centre. Illustrating the benefits of collaboration in innovation, a detailed strategy is now in place for how primary and other community-based and specialist health services will be provided for these new housing developments across Camden and Liverpool local government areas. This is a major and important piece of work and vital when you consider that over the next 30 to 35 years, this area where we meet today is predicted to become the same size as Canberra. I would like to thank all those involved in these important areas of work for their skills, expertise and passion they've contributed. This includes clinicians, primary care representatives, Medicare local councils, planning departments, universities, non-government and not-for-profit organisations, experts in health policy, and importantly, the consumer and community representatives. Now, I've mentioned briefly the Medicare Local. I'd like to dwell on it for a second for the opportunity that the establishment of the South Western Sydney Medicare Local presents to us. I think we have a once-in-a-generation opportunity to re-engineer the way that health services are provided. The time is ripe, the minds are open to break down the barriers that have existed between primary and tertiary care and to take a patient-oriented approach to making healthcare as seamless as possible. We've got a clean page to work with, we've got very good will, and we've got good working relationships with the Medicare local. And the potential benefits for getting this right for our communities are so high that we cannot afford to miss this opportunity. It was with great pleasure that I joined with the Minister for Health in May this year to endorse the work we're undertaking by launching the Consumer and Community Participation Framework. The framework outlines how the district works with patients, carers and the community to deliver healthcare, and it sets out the aims, structure, role and processes for community participation. Community participation, as the Minister has said, is the key to ensuring that the district provides healthcare which is high quality, safe, effective and appropriate and available to all regardless of where they enter the health system. Our consumer and community representatives make a valuable contribution to the delivery of healthcare and make a real difference to how health services are provided. And it's wonderful to see so many of our reps here today and down in the foyer earlier on. The Board and the Consumer Community Council work closely together. Board members attend the CCC meetings and the Board receives feedback via the CCC minutes. Each of our hospitals has an active community participation network through which clinicians, health staff, consumers, carers and the general community can have an opportunity to be formally involved in local planning, decision making and the evaluation of the services provided. There's been some great examples of how community participation in action at our health services has actually improved our quality of care. Some of these examples include work on signage and access at Liverpool Hospital, the involvement in the Cambelltown Hospital redevelopment through engagement with the MacArthur Network, some wonderful work at Bowral with community representatives surveying the cardiac assessment unit, the patients and the carers, and the Bankstown Network's campaign to ensure better public transport access to the hospital. The standout success, an excellent example of consumer and community participation, is the advocacy from some of the representatives here today for ensuring the Top 5 project is implemented, so far at 3 of our hospitals. Top 5 is a new program that helps personalise hospital care for patients with memory and thinking problems. The Top 5 tool enables staff to work with carers to tap into their knowledge and expertise of the person they care for. Carers work with staff to plan together the top 5 ways to settle, calm and care for their loved ones. Staff have found that patients with cognitive impairment have a quicker recovery, less agitation, less frustration and distress, and are able to participate in more effective communication with an increased ability to relate. I really must commend those involved in this really important project. I'd like to take this moment to thank our consumer and community representatives, our auxiliary and volunteer staff. You're an integral part of the healthcare system who generously give your time, knowledge and life experience to support of our health service, and you make a real difference to the lives of our patients, their families and to the staff across the New South Wales health system. We really couldn't do it without your help. Thank you very much. The district is committed to engaging with our community in many different ways. This year we became the first local health district in New South Wales to participate in social media. In April we launched a Facebook page for the district and soon after pages for Bankstown and Liverpool Hospital. And I'm pleased to be able to announce today that Cambelltown Hospital has its own Facebook page. With Facebook alone, we can communicate, or we can reach up to 50,000 people each week. And the numbers are continuing to grow rapidly, and it's proving to be a very powerful engagement tool. We also have developed a YouTube channel to share our online video and build on our patient information video content. Over the coming months, we'll continue to explore new ways of engaging with our community through these social media applications. I'd like to close by recognising the large number of awards that have been received within the district. The district prides itself on innovation and quality, and I was immensely proud when this year Liverpool Hospital won 2 New South Wales Health Awards. These are very prestigious awards, and this is quite a remarkable outcome. The New South Wales Health Awards are an important way to recognise the outstanding contribution of staff and showcase our commitment to quality, innovation and excellence. I'd also like to acknowledge the 4 other district finalists for their contributions. To have 6 finalists in the New South Wales Health Awards is an outstanding achievement. In fact, it's almost unheard of, and a reflection of the excellent work of our staff. I'd also like to congratulate Professor Michael Barton, who's our Research Director, who was awarded the prestigious Medical Oncology Group of Australia Novartis Oncology Cancer Achievement Award. I'd also like to congratulate Associate Professor Josephine Chow, who was awarded a very prestigious Winston Churchill Fellowship. Finally, I'd like to thank all of those involved in Cambelltown's Hospital's Community Open Day today. There was a real buzz down below when you walked in. Our hospitals are an important part of our society, and for most people, their community hospital is the place to visit when they're sick or in need of emergency care. So it's great for members of the public to have the opportunity to be involved in other settings. And it was great to see so many of them getting involved with the interactive stalls, having some health checks, receiving health information, encouraging wellness prevention, early detection, and organ donation. My only concern is that all the lollies had gone by the time that I got there. But thank you, staff, and everybody concerned for making it such a great day. Thanks very much, everyone.